In the world of medicine, one of the most interesting phenomena is the phenomena of athletic hearts. One of our ABC colleagues, Roni Camille, has taken a recent look at a new study about this subject.
Hi, I'm Dr. Melissa Wood, and we're going to talk a little bit about echocardiography and what an echocardiogram is. An echocardiogram is obtained when we bounce sound waves off the heart muscle. We use a machine that's usually a large machine, a very heavy machine, a very sophisticated machine that allows us to get pictures of the moving heart. We can actually measure the sizes of the chambers, we can measure how well the heart pumps blood, and we can look at whether or not the valves, which open and close when the heart pumps blood, are functioning normally. In this study, we're seeing the blood actually flowing through the heart with this color coding, and it tells us which direction the blood is going. We can also measure the blood pressure in the heart as well as the pressure in the lungs, and that gives us a lot of information about the efficiency or ability of the heart to pump blood normally. This is a snapshot of many of the different images that we take when we're doing an echocardiogram. We have black and white images that we use to measure the size of the heart muscle and the thickness of the muscle and the chamber dimensions. We can also use color to look at the blood flowing through the heart and determine whether or not there is leakage or any abnormal function of the heart valves. This is the valve on the left side of the heart called the mitral valve, and in this patient, who's a healthy athlete, there's no leakage of the valve identified. This is the aortic valve, which is the main blood vessel of the body, the aorta, and that valve also looks normal in this patient. This is a really important view of the heart because it actually shows us all of the major chambers of the heart and several of the valves. This is the right side of the heart. So the blood flows into the right side of the heart from the body, goes into the upper chamber, then into the lower chamber, which is the pumping chamber that pumps the blood off to the lungs. When the blood comes back from the lungs with oxygen attached, it comes in here through the left upper chamber, across the mitral valve into the pumping chamber of the left side, and then out the aortic valve to the body. So the left side of the heart is normally larger than the right side of the heart because it has to pump blood through your entire body, and the blood pressure is higher on that side of the heart.
Hello, I'm Dr. Aaron Bagish from the Massachusetts General Hospital. Today we'll be looking at basic images from a transthoracic echocardiogram. Put simply, these are ultrasound pictures obtained using sound waves that allow us to look at the structure and function of your heart. This is a typical echocardiogram machine as you would encounter in any hospital. What we see here is a sound wave derived picture of the four chambers of the heart in real time. We're able to look at the size and the contractile function of these four different chambers, and then to focus as well on the valves that separate these chambers. Echocardiography has been routinely used in cardiovascular medicine now for several decades. We use echocardiogram to diagnose a number of different heart abnormalities. When a patient comes to the hospital for an echocardiogram, we perform a thorough examination which involves anywhere from 60 to 100 different pictures of the heart. We look from several different positions on the chest, starting up by the sternum and ending up under the left breastbone, and we look at the heart from several different vantage points so that we can best characterize the heart's shape and its function. The heart is like any muscle in the body in the sense that when it is exposed to work, it changes shape. We know from having watched many athletes that when people perform high-intensity athletic endeavors over a period of time, their heart grows. Growth comes in two shapes, two sizes. One is the chambers enlarge, and the second is that the walls thicken. Based on the configuration of enlargement, we're able to tell with some certainty whether or not this enlargement is due to athletic training or some underlying disease process.
An interesting look with modern technology at the so-called athlete's heart. We ask you to go to our website, go to abcnews.com, click on the health page if you want more information about these and many, many other topics.